Welcome to the Inside Connection podcast powered by MediConnect. I am Lance O'Brien alongside Sean Horn. We got an exciting episode here today as we're going to dive into Medicare Advantage plans, which very popular subject these days. But before we get into that, if this is the first time that you're viewing one of our podcasts, we are the top rated advisory firm in the state of Pennsylvania when it comes to Medicare. We make it simple, right? That's what our focus really is: education, helping people get to a place where they can make informed decisions. We also are able to offer this at no cost, which is great, right? It's, whenever you're doing something in life, you can get a free estimate. It doesn't normally stay free, right? Well, we give the free estimate, the free service, everything along, not just initially, but the yearly review. We work with all of the major carriers. We're able to offer you the options that are available in our area, and it's a great setup for the individual consumer.
Undoubtedly, and well overdue, if I might say so myself. Medicare being around since 1965 has really come to the forefront of healthcare plans for retirees, especially in the last 10, 15 years with all the baby boomers coming along. And as a result now, all the plan choices that are made available are really overwhelming and confusing to a lot of people. So to be able to take a lot of that weight off the shoulders of people when they're doing their retirement planning and comparing their work coverage versus Medicare benefits if they're eligible yet want to keep working, whatever it may be, to be able to take that pressure off, that is really what drives our passion here at MediConnect.
It's actually a great point because if you turn back the clock 20 years, really the role or the function of an agent was more to shop price, if you will. They were just helping people find the best price. Now with so many options in the marketplace, there's truly a greater need for education, helping people get to the place where they can actually select a plan. And it is vastly different than it used to be.
60 Medicare Advantage plans in Allegheny County alone.
Yeah.
We were talking earlier this week about the fact that there's some counties out in central Pennsylvania that have 80 Medicare Advantage plans. I mean, enough is enough already. I mean, they can really boil it down to each carrier really operating within just a few plans. If they would let go of the legacy plans that cost well over hundreds of dollars a month, or really button down on how they want to offer their plans to the consuming public. So again, just make this simple, but it's almost, I've always said when it comes to Medicare planning, it's almost as though these insurance companies are trying to confuse you into a bad decision.
Yeah.
Which again, another thrill of why, us together for so long and building out MediConnect, that's really what we've tried to tackle on in the last 7-8 years now when it comes to getting our voices heard in as many different formats as possible to make sure that it's easy to engage with. You can follow along. You make the decision. We're not selling you anything. And we do it all through education and relationships, right?
Yeah. So that's really important because it's not a one-time decision. It's a yearly review, especially as your health changes, as Medicare changes. So in the last couple episodes of the podcast, we've been looking at the foundation of Medicare, original Medicare, Part A and B, really built a foundation there. Today, we're going to jump into Medicare Advantage plans. But right before we do that, Sean, just kind of let everybody know how they can access all of our services.
So thank you for being here with us on CBSN Pittsburgh. But you can also find us every single Saturday morning live on KDKA AM, 9 o'clock. Again, every single Saturday. We've been there for the last 5 years or so now. Built a wonderful relationship out there. But we're also in the process of building up our YouTube page, which you can check us out by searching MediConnect Insurance. And then you can also connect with us on Facebook at MediConnect PGH. Lots of amazing content we're continuing to push out there to, make it so that it's not as intimidating to take on because you don't have to do it alone.
Yeah, I think the reason we're so committed to the content is because we're trying to make an unpleasant experience generally pleasant, right? We're trying to, it's kind of like buying a car, right? Nobody loves to go out and buy a car because it's just like, what is this experience going to be like? And we're really at the forefront of the education process because we want to make this a good experience for the individual consumer.
We want to change the game around.
Yes.
There's no better way to put it than we want to put the power in the hands of the consumer. Unlike when you go to the car dealership and you're like, oh my goodness, I'm going to overpay. I'm going to feel like I'm getting ripped off. And, you know, when you come across a good one, you tend to latch onto that person for the duration of your car buying days. Well, we want to be that in the Medicare space because we truly feel like through the advice that we provide, which is top rated, you can go to our, check us on Google and see that there's not many out there to have as many as we do when it comes to 5 stars. To be able to take such a complex situation, boil it down, and make it actually fun and engaging to make sure that you're getting the most out of this process for yourself.
Absolutely. So today, as we jump into Medicare Advantage
Hmm.
plans, for years, this wasn't even an option,
It wasn't.
right? You couldn't get a Medicare Advantage. You had to either have original Medicare and a supplemental, which is generally what people did. So, Sean, talk to us a little bit about how Medicare Advantage came into being, and then we'll jump into what it really does for the individual.
So let's break it down this way. When you have original Medicare involved in the picture whatsoever, the government is responsible for 80% of your healthcare costs on the medical front.
Okay.
So your doctors, your hospitals, your surgeries and physical therapies, MRIs, and everything along those lines, the government is responsible for 80%. So as a result, knowing that we want to do everything we can to prolong these programs as long as humanly possible, there needed to be other options available for retirees to pick from, and some of which actually has taken a lot of that financial onus off of the government and placed it on the insurance company. So back in 1997, as a part of the Balanced Budget Act that President Clinton signed, Medicare Advantage plans were effectively born. Now, it took, like all things in government, it took a long time, unfortunately, to really come to the market
Yeah.
because here in the southwestern Pennsylvania, where we have a hotbed of opportunity, to be truthful, it didn't really come to fruition in how we know it now until about 2006.
Right.
Now, since then, my goodness, have things changed.
Yeah.
I mean, the benefits have expanded, the premiums have come down, network accessibility has really grown at the same time. So we're seeing a lot of movement there, especially from the fact that you're looking at coverages that are offered by plans that our neighbors know for a really long time through their employment years, and working for some of these companies like UPMC and Highmark and the other national carriers like Aetna, United Healthcare. So there's a wide array of plan choices, a lot of coverage decisions to make, and a lot of people in our area that obviously need this help.
Yeah, for sure. So the thought process behind it, and again, just really trying to lay the foundation when with original Medicare, there's an overarching phrase, medically necessary,
Yep,
right? Part A and B, inpatient, outpatient services, it only covers what Medicare considers medically necessary. So things that weren't considered medically necessary, Part D, prescription drugs,
correct.
which again, as you get older, I kind of see those as being necessary, right? We live in a society where a lot of people take different medications as their health changes. And then in addition to that, what we call today ancillary benefits. So what do we mean by that? Dental, vision, hearing, right? Over the counter items, vitamins, access to things like that, transportation potentially. None of that was available through original Medicare. So these Medicare Advantage plans kind of came out as the omnibus, if you will, right? Like something that would offer coverage for all of these areas. So, Sean, talk a little bit about that because I know you like to use a certain illustration in talking about these.
So Medicare Advantage plans are essentially your combo meal when you go through drive-through. So rather than when you individually order your burger, your fries, and everything like that, it's usually going to cost a little bit more.
Right, a la carte.
Correct. Whereas when you're getting the combo, they usually bring the price down a little bit, and you're getting everything all in one bag. So you're talking, as you just mentioned before, your hospital, your medical, your dental, your prescriptions, your hearing, your vision, all in one package where you get it on one insurance card, really. And really, the insurance company that is named on the card of your choosing, they basically oversee all parts of your Medicare coverage, which there's a lot of good to. There are some, detriment to as well. And we'll break all of that down here shortly. But when it comes to the popularity of these programs, again, especially in the last 3-4 years, there has been an explosion, especially here in southwestern Pennsylvania.
Yeah, and I think that's a good point because it is, as all insurance, it's based on zip code, right? If I go out and I want to get car insurance, like I moved from Westmoreland County not too long ago to Washington County, automatically I had a change in my car insurance rates, right? My home changed because it's all insurance is based on zip code. So we're very fortunate here in Western Pennsylvania, even through Central Pennsylvania, that we have very good Medicare Advantage plans. It makes it as a very attractive option for people, where there's other states that are more supplemental heavy, if you will, just because of the options available to them. So why do you think, Sean, that there's so many good options for Medicare Advantage here locally?
It's population based. It really comes down to that. When you have this many people in southwestern and central Pennsylvania who need this type of insurance, and then when you have formats like ours that are consistently trying to educate you on the wonderful benefits that are available if you're just willing to listen, it really makes it so that the insurance companies are meeting the consumers where they're at as opposed to the other way around. So, I mean, southwestern Pennsylvania here, Allegheny County, where we're currently sitting, it's the third most populous county in America for baby boomers. So you have that going for you. Plus, you have the wonderful healthcare systems that surround us. And we're truly blessed by that, by the way. I mean, when you're talking what UPMC and AHN have to offer, some of the, Heritage Valleys and everything like that. I mean, we're truly blessed to live and benefit where we do. So put all of that together and the education on top of it, it's really going to drive competition. And in this format here, when it comes to insurance, competition is king. It is going to drive price down. It's going to extend benefits out. And oftentimes, we're going to talk about this a little bit more in the next segment, but we've been on the radio now for over 5 years talking about the fact that if you're paying more than $35 for your Medicare Advantage plan, you're paying too much.
Right. Yeah.
Break that down a little bit.
Yeah, so we're going to really jump into the pros and cons. And I think it's important to kind of say right now that we don't believe supplement is better than Advantage plan or Advantage plan is better than supplement. They're just different, right? But in this podcast today, we really want to get into the nooks and crannies of what people really like about Medicare Advantage and then what they don't like, right? But yes, one of the things they like, which we'll expound on here shortly, is that the coverage is very affordable. As one of the two types of private insurance that people can get to supplement their original Medicare, at least upfront cost-wise, it is got a more attractive price tag to it. You can get really good coverage for less than $35 a month. You don't have to pay $200-$300.
And on top of that, these plans often function like your group benefits did during your employment year. So you're used to paying a copay when you go to the doctor, a little bit more when you go into the hospital or emergency room. It's the same type of functionality, really. So it's comfortable when it comes to that switch. So thanks for joining us today on the Inside Connection podcast. Stay tuned as we're going to break down a little bit of the donut hole that we talked about in the last show during this commercial break. And then we're going to come back and talk a lot more about why Medicare Advantage is gaining in popularity.
Welcome back to Medicare in a Minute. In this video, we'll explain the prescription coverage you get with Medicare. Part D can be found in most Medicare Advantage plans or as a standalone with a Medigap policy. Unless your prescriptions are coming to you through the VA or you receive extra help from the state, you will need to enroll in a drug plan, even if you don't take any medicine, to avoid a penalty. Drugs will be grouped in tiers based off cost and whether they're generic or brand name. Below is a diagram of the dreaded donut hole. If your plan has a deductible, you'll have to pay through. You will then pay copays for the drugs you take until they all total in retail costs the number below. If you enter the donut hole, you'll pay 25% of retail on all of your prescriptions. This process resets yearly on January 1st. To review, Part D provides prescription drug coverage, which can be both confusing and very expensive. Anytime you think of Medicare, it's time to connect with MediConnect. No cost, no obligation, just good information.
And welcome back to the Inside Connection podcast powered by MediConnect. I'm Sean Horn. He is Lance O'Brien. And if you have any questions surrounding what you just watched as it relates to the donut hole and prescription drug coverage coming from Medicare, or anything we covered today, or hereafter related to Medicare, 888-818-6334 will get your answers right away to make sure you're in the best spot possible when it comes to your coverage options as you're entering retirement. So we've spent a lot of time in the first segment already talking about Medicare Advantage plans, breaking down a little bit of the backstory.
Yeah. The
You know,
why.
the why, for sure.
Yeah.
And now we want to kind of give a little bit more accessibility to how they function, why they're at such low price points, and some of the coverage options available inside of them. So to spend a little bit of time talking about that avenue of coverage as you enter Medicare, again, we're seeing a big swing. It's estimated that between 60 and 70% of people in southwestern Pennsylvania, similar in central Pennsylvania, are on Medicare Advantage plans. Why do you see this swing is taking place?
Yeah, so I mean, I think there's a number of reasons. I think one of the first ones is people who got onto supplements as they age, as they get older, as it goes up, so does the price of their supplement, right?
Sure
So
does.
they could start at a level where they're like, oh, this is pretty affordable. And as they begin to spend through some of their money or whatever, inflation, you name it, things happen, that monthly payment goes up and it can become cost restrictive for them. Whereas the Medicare Advantage plans, you're not going to be in the hundreds of dollars to have one of them. Now, are there plans out there like that? Yes, right? But generally, first thing that people like about the Advantage plans is that they have a cost-effective premium. And the reason for that, Sean, is because they're no longer primary to Medicare, meaning they're now on the Medicare Advantage, which is offered by a private insurance company, which means that the insurance company is getting some money from Medicare to offer the plan. They're able to offset some of that cost, which enables them to offer it for that low monthly premium. But I think beyond that, what people really like too is every Medicare Advantage plan has to offer a max out of pocket. What does that mean? Why is that important?
So Medicare Advantage and the functionality of a maximum out of pocket, it's a financial shutoff switch. So you can't spend more than X dollars per year on anything that happens to you medically. So it doesn't go in perpetuity. It's not gonna. These are usually high dollar amounts still when it comes to what your outlay may be in a bad year, but there is eventually a shutoff, which is phenomenal. But also on top of that is the idea that there are so many extra benefits made available through Medicare Advantage plans that original Medicare cannot offer.
Right.
I mean, we're talking things as basic as dental, vision, and hearing. There's also, as you talked about in the opening segment, the over-the-counter allowances and all these extra goodies like the gym memberships, and some of them are having like co-pay debit cards and other assistance programs inside of their coverage because, again, times are a little bit tougher right now when it comes to the economy and the stretch on the budget. So these insurance companies are trying to become almost overarching on all factors in retirement. And we're seeing a lot of movement in that way when it comes to people actually benefiting more now than they did 10 years ago when it comes to Medicare Advantage.
Yeah, and I think the design of these plans was really to meet the deficiencies of original Medicare, right? Original Medicare, no max out of pocket, right? So, like, if that's all you have is a red, white, and blue card, no private insurance, you could have some significant out of pocket costs if you have a significant health event, right? So, that's one issue right there. And then because it doesn't offer the ancillary, so that's what people really like about these Advantage plans is number one, I get the max out of pocket. Number two, I get a low monthly premium, right? It could be as little as $0, extra coverage for no extra money. And people are like, well, you don't get anything for nothing, but the coverage is actually pretty good, which leads to, I think, the third thing is with these Advantage plans, the copay structure, for the most part, is much better than original Medicare.
Mm-hmm.
It's no longer 20% for everything on Part B, which we're going to come back to in a few minutes on the cons, right? But then you also get the holistic coverage. So there's those four things, right? Max out of pocket, low monthly premium, better copay structure, and everything in one policy that people really, really like. What do people not like about these plans, Sean?
Yeah, so we liken it to, Medicare supplement or the Medigap plans are like you're prepaying for your coverage. In a horrific event, you're going to be pretty happy you have a Medicare supplement. Whereas with a Medicare Advantage, You're paying as you use it.
Yes.
And if you're lucky enough to not have significant health events occur, you're going to save a lot of money. But the minute that something does happen, you're generally going to pay a little bit more out of pocket than you would with a Medigap plan, unfortunately. And by severity of whatever it is that you need, if you're just going to the doctor, generally you're going to have no or low copays. But if you're admitted to the hospital, if you're going through CTs and MRIs and things of those natures, if you're admitted to skilled nursing, all of these things can really add up quickly, unfortunately. But another aspect of the way the Medicare Advantage plans work that some people get a little turned off by is the fact that generally you're going to have to abide by a network.
Yeah. So Medicare is no longer primary if you go to
Mhm.
an Advantage plan, which means you can no longer go to any doctor or hospital that accepts Medicare. So now you're looking at an HMO and a PPO. And I definitely think this is something people need to take into account, but I also believe it's not as big of a deal as it was maybe 5, 6, 7 years ago.
Could not agree more.
There's some really significant changes to how the plans are structured, where now if some of the PPOs that are available in our area have the same copay, whether it's in or out of network. So let's talk a little bit about real quick, because I do think it's important. What is an HMO? What is a PPO?
HMO is a health maintenance organization, which effectively means you're going to be tied into a regional network, other than when you're traveling in a case of emergency. Generally, that's going to be covered no matter where you're at. But otherwise, you're going to have to stay within your localized network, and your primary care doctor is going to be the gatekeeper to your health care.
Okay.
Meaning that they're going to have to pre-authorize everything that happens to you. Go see a specialist, you need a referral. Go get this test done, they have to sign off on it, and many things of that nature. Whereas with a PPO, preferred provider organization, there's a lot less restriction when it comes to accessibility outside of your localized network. So some plans, like you were just talking about, are going to have the same copay in or out of network, which is a game changer for a lot of people. Gives you the flexibility to travel without having to worry about something happening in your health, at least inside the continental United States. But when you're looking at, even if it's not one that offers the same copay in or out of network, you may have a slight upcharge as you're traveling, but the ability to be able to go and see as you're traveling in case something happens, it's a pretty big deal for a lot of people, because these Medicare plans now, both Medigap and Advantage plans, they're realizing that today's retiree, they don't usually lie dormant. They like to do a lot of more traveling, like to
Yes.
get out there and live, which is fantastic that they're so supportive of that. Well, their coverage needs to follow suit as well.
Yeah, and I think that's one of the beauties of the development, really, of the Advantage plans, is they've seen where they were deficient and they're addressing that, right?
Correct.
Some of the plans locally give you full access in certain states in the country. One of the major national carriers, actually two of the major national carriers, give access pretty much to their nationwide networks. If you have that carrier and you're in another area of the country, as long as they accept, say, an Aetna or United Healthcare, then you would be able to see doctors across the country that way. So there's really been some massive improvements on the network, although it is a liability. And I do think the last thing we really want to talk about is, in general, the copay structures of the Advantage plans are much better than original Medicare. Because again, original Medicare is 20%, right? On the hospital, it's a deductible and then a daily charge once you
Mm-hmm.
get to a certain amount of days. Like, there can be significant out-of-pocket costs. A lot of the copays on the Advantage plans are very reasonable. I mean, blood work for no copay, primary care, $0, $5, specialists anywhere from $10 to $20, $30, right? So they're pretty affordable. But Part B drugs, talk to the people about Part B drugs, because I think this is something that anybody who goes into an Advantage plan should be thinking about.
For sure. And this is a major difference in the ways that Medicare Advantage plans differs from Medicare supplements. So with a Part B drug, which is basically anything that's administered to you in a doctor's office or in a hospital. I mean, the biggest one that people unfortunately come into contact with in relation to Part B is like chemotherapy, for
So
example.
it's like an injection or an infusion.
Correct.
Okay.
So that type of medication that's Part B, injected or infused, it's going, no matter what Medicare Advantage plan you have, it's going to be a 20% co-insurance each and every time you use it. And that could come up pretty quickly when you take into consideration the cost of chemotherapy and other injectables. And, a lot of things that people need to be cognizant of is the fact that that is one area where you can very quickly hit the maximum out of pocket dictated by the plan. So you have a $7,000 maximum out of pocket, and unfortunately you're diagnosed with something along the lines of cancer or needing some other sort of radiological therapy. This is where it can get you. So
Yeah.
you really have to take that into consideration as well. But I do want to harken back to one aspect that we really haven't covered when it comes to Medicare Advantage, but I think is a pretty big game changer as well. And it's the fact that there is never any medical qualifying necessary when it comes to going from one plan to another. That's huge for a lot of people because in that scenario, where you may be looking at chemotherapy or something that carries that 20% co-insurance, in that scenario, we can move you from a plan that you may have now to the one that has the lowest maximum out of pocket with no health questions asked to save you thousands of dollars in that scenario.
Yeah, I mean, it's really a great point. I mean, less than 5% of people hit their max out of pocket
Right.
on a yearly basis, right? But if you get cancer and need chemotherapy, that's generally when it's going to happen. So to your point, which is a great point, say you're in an Advantage plan that has a maximum out of pocket of $7,000. You're happy there because the benefits are really good, right? You're getting copays, you're not really using it. You get that diagnosis. You could get into a plan that has a maximum out of pocket of $4,000, which is really going to protect your assets in that given year while still giving you access because they can't deny you coverage, which is not true of the supplements. We're not talking about supplements today, but there can be medical underwriting with the supplements, but not with the Advantage plans. That is very important to know.
And really the whole functionality of why we're here, because we readily understand and realize the fact that whenever you're working all of these years, accumulating what you need in order to retire, you're not setting aside a little slush fund for when you get sick. At least no rational person is usually doing that, right? They're accumulating so that they can retire in comfort. Well, a situation like a health crisis such as cancer or something along those lines, a major heart situation, that is something that can very quickly get you elevated to that maximum out of pocket type of situation. And our goal is to make sure you never have to spend more than necessary as it relates to anything insurance with Medicare. So when you need that type of help, you need to connect with MediConnect. 888-818-6334. You can also go to MediConnectInsurance.com. Find us on YouTube by searching MediConnect Insurance, or you can connect with us on Facebook at MediConnect PGH. You can always catch up on these episodes that we run in your time, not ours, so feel free to connect as you need. In next episode we come back with, we're going to be talking a lot about Medicare Supplement.
Yeah, and again, still very popular. There's definitely a need for it, especially in areas of travel, areas that relate to maybe someone uses a lot of specialists. So we're going to do very much the same thing. We're going to give you the backstory, dive in deep, pros and cons, and really help move the education forward. Looking forward to being back shortly with that podcast.
Thanks for joining us on the Inside Connection.